So yeah, until a week ago, I didn't know what AWOL was. I'm just kidding. I'm just kidding. Um, so I'm excited here to share with all of you what we're doing with AWOL at Suvida. But first, I'll start a little bit with about what Suvida is. So Suvida is a healthcare organization focused on providing primary care to Hispanic seniors. We're located in Texas and Arizona. And essentially, we saw that there was a niche in the market specifically for Hispanic seniors. They have several social, cultural challenges with receiving care. And that's where Suvida's primary care model comes in to provide that support. So we work with Medicare Advantage patients in our markets. And essentially, we noticed that there's a lot of other health disparities that we can try to close with our care model. So I'll go through some of the tailwinds that are supporting us as an organization. One is that Hispanics are the fastest growing population in the United States. They actually choose Medicare Advantage at a higher selection rate. Um, One fun fact in Puerto Rico, where I've been trying to encourage Subida to operate, I believe over 70% of the population is actually on Medicare Advantage. So if you guys do CareOps next time, let's do it in San Juan. Um, Also, higher life expectancy at age 65. And there's also lower healthcare spending. So there's a lot of good things specifically for this target population over others. And that's kind of the reason why Suvida was created. Now, a little bit about our team. So we provide a comprehensive, large care team. So as you see here, we have 7 different roles. So we have 100 different providers across 14 different clinics. We opened up our last one actually when the AWL team was with us last week. So we have to basically coordinate a lot of care, and a lot of the services our providers could do can also be done by other providers on this list. So there's a lot of overlap. So the challenge for us when we think about a platform is in care management. How do we properly coordinate that care across the population? So we first started out with another platform, to be honest. AWOL was not our first pick, not the first one we had to dance, but let's talk about actually what happened. So our initial care management platform, we had I think some of the standard problems with the system. One being if we wanted to change anything or expand the capabilities of it, we had to ask for custom development, and that was we were billed an hourly rate for that. The other aspect is in order to get the data out to track actually what was happening, we had to kind of rebuild the entire care flow process by understanding actually the engineering principles of what was happening. And then finally, we had little or no API access in that platform. So that kind of really limited what we could actually automate from our internal software engineering team. So this last week, I've had the pleasure of actually really getting deep into the AWOL platform. And I think there's a couple of things I'm like really excited about. One is that we're actually having an opportunity to work with our clinical leaders. I know a lot of clinical leaders, and I think Sana pulled me aside because she was worried about how many people I was telling about AWOL, but they're eager to get into AWOL. We started showing them what's possible, and we know that they are eventually going to be the ones building the actual care flows. Another aspect is actually that we can customize the work list. So this is really important for us is that our teams are coming to us with slightly different filters that they want added. We also want to try to make it beautiful for them. So we do try to engage in user-centered design. And I think having the work list being able to customize in kind of drag and drop fashion helps us with that. And then finally, the aspect of being able to fully explore the Elation API. So we have a development team, we have software engineers, we can play around with Elation's API on our own. However, the speed to actually exploring the API and being able to deploy something is really big for us, and Haywall supports that. Again, just to reiterate a couple of the main gains I'd like to mention is the ability to modify the work list, the ability to rapid iteration of the workflows, automation of a lot of the manual work. So a lot of things that we're currently doing where we're checking to see if an appointment's already been scheduled before having our call center reach out to the patient. These are small things, and we're saving time by having a well kind of do the automation of that. And my background is in data and analytics, and one of the nice things is that one, it's a BigQuery, so we were able to get the shared service set up with AWell. and we were able to really quickly understand the data model right off the bat. There wasn't honestly didn't need any more support other than asking JV to get us to connections. So that was great. So finally, just to give you a sense of what we're thinking about, this is a little bit of a snapshot of who we are right now and where we're planning on going and why we're excited about using Awell. We have about 400 staff members. We were started in 2022, and so we scaled up from 0 to 14 clinics over the last 2 years. And again, it's slightly out of date. We're excited. I mean, we've been able to do a lot of this work with a lot of manual like spreadsheets, a care management platform that wasn't working, and but we see that we know we want to get to even higher growth, and that's where AWell really comes in to support us. And we're excited about how we can scale as an organization using AWell as a platform and iterate. So that's it.